This is Heart Rhythm TV. My name is Janet Hahn, and I'm here today with the distinct pleasure of talking to Dave McManus, who is the editor-in-chief of Cardiovascular Digital Health Journal. So I have you all to myself for a few minutes to be able to
Thanks for having
chat about anything I want. So I want to talk about the journal. So first, congratulations, many congratulations. Just got Pubmed indexed, right?
That's right. So thank you, Janet, for hosting and for helping us talk a little bit about the journal. We are really excited. We're entering into about year 2.5, kind of early year 3 time frame. And despite that, we've been able to accumulate enough really good papers that we've been able to submit and be approved for Pubmed Indexing, which is, as you know, a pretty big deal because it's attractive to scientists who are going to be submitting their papers because these appear on the National Library of Medicine, online on PubMed, and so we really have started to see an increase in the number and quality of papers that we're getting in the digital health space, which is great.
Yeah, no, that's outstanding. It's especially for such a young journal to get that recognition. I think is so important.
Well, you wrote one of the papers, so thank you. I should be thanking you.
Yeah, no, thanks for having us. I think that's great. I want to also talk about what the journal is looking for, because I think, you know, we get into this thing where it is sort of related to FHRS,
Right.
but tell me a little bit about, is it just EPs or what is it?
It is not. I would still say that heart rhythm specialists make up the majority of the submissions, and I like that as an EP myself. And certainly the fact that Heart Rhythm Society sponsored the journal, and we get a lot of play at the meetings, and after that we see a spike in submissions, certainly, and we're grateful to that. We are starting to see an increase in the non-EP cardiology digital health research submissions, and particularly around imaging, for example, as well as in the heart failure space. So we're a cardiology-wide focused journal. And when we talk about what is our focus? Because you can almost, digital health may sound small to the non-digital, but in fact, there are a lot of ones and zeros out there and a lot of different takes on what digital health means. But I would say our sweet spot thus far have been in mobile health, telehealth, virtual care, delivery types of research, and implementation of digital health tools in cardiology practices. So, for example, use of Apple Watches have been a big topic of discussion at the meeting here about how do you actually handle the data coming from these devices, from patients submitting them asynchronously. Well, that's, the how-to guides that we're seeing, the experience papers that we're seeing are really, we provide a unique place for practitioners, including allied professionals, cardiologists, EPs, heart failure specialists, and also informatics-oriented people to submit their experiences and their studies. So that's, if you look at what we're about, broadly speaking, it's about how do we implement digital health in a meaningful way to take better care of our patients. And I'd add one last thing, which is to say, each quarter we have tried to divide up this big digital health space into a focus. So for example, right now we're focusing on behavior change and prevention. So we're seeing a number of submissions that have to do with, for example, using apps to change behaviors around activity or weight loss to try to help with AFib or help with blood pressure management. Prior to that, we had an AI and machine learning oriented, and that was much more about how do we use electronic health record data to identify patients at risk or deliver digital therapeutics. So each quarter we try to break up this big space and focus it in on one of our core content areas.
No, I think that's outstanding. And so for anyone who's listening who's prevention, obviously get your papers
get
in
your
here,
paper
right?
in.
So again, not just EP, but it's general cardiology, heart failure, imaging, what have you. So I think that's outstanding.